Hello everyone, my name is Marissa Hershock. Today I have with me my mother Suzanne, my nephew Gavin, my nephew William, and my sister Carlina. Do you enjoy sports? Do you know anyone who has been involved in a sport? Do you know anyone who has ever been hurt while playing or doing this sport? I'm sure most of you are going to say yes, because it's very common. Most people you know, or even you yourself, has played a sport or activity in your lifetime. Sports are entertaining to watch and even more fun to play. Athletes can be defined as people who have the skill to play a sport. While playing these sports come the risk of injury. Sports injuries are very common and they happen daily. There are over 10 million injuries related to sports each year. In the U.S., about 30 million children and teens participate in some form of organized sport. More than 3.5 million injuries happen each year, which causes participants to miss some time. There are many kinds of injuries that happen throughout the body. There are minor injuries that can be healed over a certain amount of time. There are also major injuries that take therapy and even surgery. These injuries are called acute injuries, which occur suddenly while playing. Then there are chronic injuries, which can happen over time. Every athlete heals and handles injuries differently. Some are so severe they are even life-threatening or career-ending. Sports injuries can happen to any athlete. Whether you are a child playing recreational sports, a high school or college player, or a professional sports player, injuries can happen to you. In the handout in front of you explains in some detail some of the sports injuries that may occur. Sports injuries can vary from how small and minor they may be to how severe they may be. Some minor injuries, which are about 95% of sports injuries, are ones that involve soft tissue that can affect the muscle, ligaments, or tendons. Contusions, sprains, and strains are among these minor injuries. Contusions, which is another name for a bad bruise, is an injury often produced by a blunt force, like a kick. The result in this happening will be pain, swelling, and even discoloration of the skin. A sprain is an injury to a ligament, which is often caused by a twist of some sort. Sprains often affect places on the body like ankles and wrists. A strain is another type of a minor injury, which is when an athlete overuses, forces, or stretches their muscle or tendon. Some major and more severe injuries that take much longer to heal can be tears and fractures. Fractures are breaks in the bone. There are different ways to classify a fracture. There are hairline fractures, which is a thin break that may not go through the entire bone. There are then stress fractures, which are weak spots or small cracks in the bone. Lastly, there are compound fractures, which can be the most gruesome. Compound fractures are when a broken bone protrudes through the skin. The top most common injuries that occur in sports are ankle sprains, groin pulls, hamstring strains, shin splints, ACL tears, and tennis elbow. These injuries are known as acute injuries because they happen most of the time suddenly. Minor and major injuries affect every athlete differently, meaning it could take one athlete a longer amount of time to heal than it takes another athlete with the same injury. Concussions can be a minor or major injury depending on the severity. Concussions are temporary unconsciousness because of a blow to the head. Concussions can cause permanent damage if not taken care of correctly. Concussions are also another one of the most popular injuries because they happen so easily. The smallest hit or fall can cause a person to have symptoms. Trainers and doctors have taken concussions so seriously because of the risk that it holds when concussions go untreated. Recently, I have witnessed a concussion happen. I am a high school cheerleading coach. While my team was warming up at a competition this past weekend, two of my cheerleaders collided while tumbling. One of the girls was kicked in the head at full force by the other. She was knocked instantly to the ground and the trainers on site gave her a concussion test. Although there was no doctor there, the trainers believed that it was too risky for her to perform. Concussions happen in many sports, including cheerleading, hockey, soccer, and football, just to name a few. Football is considered to have the highest concussion rate, even though the players wear a helmet. There are studies that have shown long-term effects that may occur due to concussions. Many professional football players and professional wrestlers have experienced long-term problems called PCS, which means post-concussion syndrome, due to repeated blows to the head. Although there are some injuries that are bound to happen no matter what, there are a couple ways to prevent these sports injuries. The first way to prevent an injury would be to wear the appropriate protective gear. Helmets and protective pads are very important while playing an impact sport, as in football and hockey, for example. Helmets and pads during these sports can either prevent an injury or lessen the severity of it. Helmets are worn not only during football and hockey, but also baseball, softball, snowboarding, and skiing, to name a few. Getting an injury can be a real bummer to many athletes because it means that they are most likely going to miss some practice time and playing time due to it. A common thing that athletes will do is play before they are fully healed, or continue to play while they are already injured. Wanting to get back in the game is very normal, but it could only make things worse if you do not fully commit yourself to healing and returning before your injury. The best way to know if you are fully healed from an injury is to see a professional doctor, and only returning when you feel back 100%. Every athlete reacts and heals differently. There are cases where athletes will want to return quickly, and then there are times that they will be worried about returning. When a certain injury happens once, there is a high chance the same injury will happen again. No matter the case, taking the correct direction to healing is very important. Athletes who return too soon are more prone to injury or could even cause permanent damage. Every athlete, depending on the injury and how bad it is, heals differently. There are many different approaches for an athlete to get back out there, including therapy, exercise, and most importantly, rest. As for concussions, the only thing you can do is give yourself time to rest and stay out of harm's way. As for minor injuries like bruises, strains, and sprains, the best treatment is known as RICE. On your handout, you will see that RICE means rest, ice, compression, and elevation. Many of us had suffered these minor injuries multiple times. I myself have sprained my right ankle multiple times. In my experience, I used the RICE treatment by first staying off the injured ankle as best as I possibly can, even if that meant using crutches. Then I would ice the ankle on and off right away. I elevated and wrapped the injury to help swelling and support the ankle from moving too much. If during a sprain injury the ligament is torn, surgical repair may be required. If during a strain injury the muscle is torn, surgical repair may be necessary. As for more serious injuries like tears and fractures, the athlete will need to have it surgically repaired, and then therapy may be done afterwards to help the athlete bounce back. Many professional sports players who are seriously injured must do therapy for months to gain strength back in the weakened, injured area. Although sports are very entertaining and fun to play, they can be very dangerous. Having over 10 million sports-related injuries per year occurring, athletes should do their best to take caution and trying everything to prevent serious injuries from happening. Whether an athlete has a major or minor injury, taking the best care of themselves post-injury will always be the best way when wanting to come back to the sport. Overall, sports injuries can be life-threatening. Therefore, taking care of your health should always be your #1 priority. Thank you.